Hello, 9 to 5ers. I'm Elizabeth Ajadi, host of 9 to 5 and everything in between. Welcome back to season 2. Today, we're going to be discussing trends disrupting healthcare and reshaping preventive care. The healthcare industry is undergoing a rapid evolution driven by technological innovation and a focus on value.
We've seen technology help improve healthcare. Even the doctor seeing you in the clinic at times is using a scribe, an AI scribe, to dictate their notes. The notes are being recorded so that the doctor spends less time on chatting and can actually focus on you.
These disruptions are significantly reshaping preventive care, moving it towards a more personalized, proactive, and accessible model that empowers individuals to take greater control of their health and well-being.
Your smartwatches, some of them are even so advanced that they will check for abnormal heart rhythms.
Yes.
And they will
Your
let
oxygen
you know.
levels.
Yes.
Today's guest is Dr. Oluwatoyin Opelami. She's a board-certified internist with extensive experience in adult primary care, urgent care, and value-based care systems. Driven by a passion for expanding access to quality healthcare, she founded VTR Health in the United States and TeleMD in Nigeria, both providing accessible telemedicine care to patients virtually. Dr. Opelami earned her medical degree from Olabisi Onabanjo University in Nigeria. She furthered her training in the United States, completing an internal medicine residency with a focus on primary care at the Cleveland Clinic, followed by a primary care fellowship at Metro Health Medical Center in Cleveland, Ohio. With over a decade of experience as a primary care physician, Dr. Opelami is deeply passionate about the management of chronic health conditions. She is dedicated to empowering and educating her patients to take an active role in their health journey. Through her clinical practice and pioneering work at VTR Health and TeleMD, Dr. Opelami is committed to providing comprehensive and compassionate care to her patients, leveraging both in-person and virtual platforms to promote well-being. I look forward to this conversation today and know that you will learn a lot, like I will as well. Stay tuned. Hi, 9 to 5ers. I'm Elizabeth Ajadi, host of 9 to 5 and everything in between. Today, we're going to be discovering healthcare trends that reshape preventive care. And with me in the studio is Dr. Oluwatoyin Opelami. She's a board-certified internist and also the founder of VTR Health and TeleMD. So she's well-rounded in healthcare, preventive care, and now is shaping or focusing on shaping telehealth, bringing healthcare to you in the comfort of your home. Today, we're just going to be talking around emerging trends around preventive care, specifically honing in on her subject matter expertise, which is telemedicine. And welcome to the studio, Dr.
Thank
Toyin.
you for having me. Thank you.
So I'll be biased in saying that Dr. Toyin is like an auntie to me. She's my auntie Toyin. And
Don't mind her, I'm still young.
okay, big sis.
Big sis what?
And I've known her for about 12 years now, and we have a very good relationship, just even outside of the professional setting. And we're hoping that this conversation today really helps listeners to not just reconnect back to taking care of themselves, but learning the different ways with which they can take care of themselves, because we're striving to be that as well. First of all, I want the audience to get to know you. So let's just tell them a little bit about you for a second.
Well, I'm Toyin Opelami. I'm an internist, fellowship in primary care. Worked in primary care for about 10 years. And then I decided to go into telemedicine just before COVID. So I was still working, employed, and I was looking for a way to balance home, balance work. So I decided to try something I could do from home. My little son was always getting sick, needing to be home. And then COVID came and telemedicine blew up. So after a while, I decided I could do this from home. And I was like, I could do this by myself. That's how telemedicine started for me. And then I started telemedicine in the US. And with rising need for good and quality healthcare in Nigeria, access and affordable healthcare in Nigeria, we decided to branch out to Nigeria. So we have telemedicine, TelMD, also in Nigeria. Thank you.
That's amazing. I love it. In my research, I was looking at different emerging trends in healthcare, generally speaking, and a lot of things came up. AI, artificial intelligence, and how that is impacting healthcare. I'm very interested in that, in how it's impacting drug discovery, personalized treatment plans, and just honing in on taking care of the patient. Telemedicine, it's like top of the list there. Digital transformation, interoperability, my charts. I recently saw that my chart is now connected across the different hospitals that I've used over the years, and so all of my doctors can see my health history, which was not the case before. So from your experience being in the industry, this is just from me doing research, like what is a top emerging trend that you're seeing in healthcare today?
Technology and healthcare. So in various aspects of healthcare, we've seen technology help improve healthcare. You mentioned some from documentation. Even the doctor seeing you in the clinic at times is using a scribe, an AI scribe, to dictate their notes. The notes are being recorded so that the doctor spends less time on chatting and can actually focus on you. And when you get personalized care, like you said, genetic testing, now some diseases are being found so that personalized treatments are being given to people who need them. And then we're talking about even getting access. One of the things I'm working on currently is trying to merge AI, put AI on my website so that when you come in and there's a difficulty registering, the first interaction you get is like the chatbot. Yeah. Who helps you register, then passes you on to the nurse. And also in Nigeria to help you translate, because at times there's English difficulty, right?
Right.
So translating different languages. So we're still trying to work on that. And so this will help improve the quality of health, because the patient can then explain, this is what I need, this is who I want, and we can source for a doctor who would understand and who can relate well with the patient. And not just that, when we talk about the EMR, the EMRs, like you rightly said something, they're now interconnected. And then you have access to your medical records. So you don't have to go to the hospital you were in and ask them, I need my records to take to my new doctor. The doctor can easily access it online. So there's the interconnectivity happening to even going to wearable devices these days. Your smart watches, some of them are even so advanced that they will check for abnormal heart rhythms. And they will let you know. And some of them will tell you that, oh, your activity has gone down, your VO2 max is down, is less than average, you need to start exercising more. So all those things, and some of them can be connected to your patient portal, so that your doctor also sees your record. And even there's so many things, glucose monitoring devices. So we have the continuous glucose. So technology is making and improving medicine, and we're happy with that. I, as a doctor, I am happy with that.
I definitely appreciate that. You know, I was recently on a vacation in Europe. I was in several countries, and my watch was recording my movement. It just kept sending me all these messages every day. And 2 days after I go back into the US, obviously I don't walk as much. And so it said, well, your activity level is decreased, and it gave me this note about how this could impact this, and I go, yeah, I'm back in the States, so there's not
I don't walk as much.
I don't walk as much. I appreciate those little reminders from this small device that started as a watch, but it's now almost a game changer for my life and health. In that it's reminding me that even if I don't have the opportunity to just naturally walk in the US, I should probably get up and walk and do something and pay attention to that. You mentioned the AI on the website. I love that, especially the translation models as well, because I think access to healthcare can be bridged by even just that little transformation there, in that if I come in and I don't speak English, like I should still be able to access care. And that's helpful in that as a doctor, I don't need to understand your language to be able to do that for you. I want to talk about rising healthcare costs and how that has probably contributed to telehealth and all these diverse changes that we're seeing in healthcare. What are your thoughts on this?
I am very biased. So I would say this is one of the reasons I left work as an employee, because of insurance agencies. Unfortunately, they are not primary care physicians' friends, because you have to do all this documentation and you have little time focusing on your patient, and all you're doing is chatting, signing forms, doing all this administrative things and not paying attention to the patient. So, and the patient still keeps on paying heavy premiums to get seen, to get that quality of care. So I am not satisfied and fulfilled as a physician talking to my patient. And my patient is not getting
the type of care that they want or they aspire for.
So this was one of the reasons. And also still thinking about it, I figured I could create a practice where my patients would actually pay me out of pocket and they get quality time with me.
Okay.
And you see a lot of that these days. So it's like a membership. People would pay to see you.
Yes.
Right?
Like a subscription service.
Yeah, like Netflix, DSTV, all those things. And they get to see you as often as they want, depending on what they've paid for.
Correct.
And some of them will just end up paying minimal for labs, for specialist care and things like that. So that works better for a lot of people.
Correct.
And for people that cannot afford insurance at this time, they still have the option of seeing me for urgent care. I see people like that. I do not have insurance, but I need to see a doctor. And I see a doctor this one time and I know what's going on with me. I get my prescriptions and I'm fine. The United States has one of the highest when you talk about costs of healthcare. And it's not as though that translates to better care.
No.
Yes. So for me, as a primary care physician, I would think you would focus on preventing health issues from arising.
Correct.
That when you prevent health issues from arising, then down the line, your cost is minimal. Because if you focus on preventative care, then chronic health issues do not arise.
Correct.
And then complications don't arise. So the need for procedures, the need for hospital admissions because of morbidity, it doesn't arise. So healthcare cost goes down. So I'm very happy with the changing things in healthcare policy and primary care support now that is happening now.
Yes.
Healthcare needs to be affordable.
Right.
It's one of the basic needs of a human to be healthy, to be able to function and do their day-to-day things. So if they cannot afford to see a doctor, what exactly are we doing?
Exactly. I definitely appreciate that perspective, because even as somebody who can afford it, sometimes I get my bill and I go, whoa.
I got a bill and I went, whoa.
You know, I have a hair loss in the middle of my head from a type of alopecia. And I had to go in and my doctor was like, oh God, thank God you came in early, because this has to be treated. Otherwise, it could become a total hair loss and there's nothing they could have done about it. And so she gave me an ointment and I think minoxidil to use, and we tried it, but I think it worked for a few weeks, and then later it stopped working. I just noticed the hair is not growing. And so I took a picture and sent it to her, and then she had me come in and we did this injection there. And I got the bill. and it's almost $1,000, my out of pocket, and I go, wait, what? Is it not just 3 needles?
Yeah. That doctor
I was in there for less than 10 minutes.
But the doctor put his or her hands on you.
They did.
That's a bill.
I was in there less than 10 minutes and now I have to pay that much. And I think back to other people that cannot afford this. I'm like, so they just go bald because they can't afford it. Like for me, that's a luxury. And that was an eye-opener for me. And that's even recent. And that's with me having an HSA card that I contribute to on a weekly basis from my pay company to be able to pay into it, to be able to afford these types of things when they arise. But not everybody can afford that. So I like the subscription-based idea. It's the first time I'm hearing it. I didn't know that was a possibility.
It is. A few people do it out there. Maybe a lot of people do it out there. But for me, it helps the patient. Number one, the patient feels some sense of ownership.
Yes.
Right? I am paying for my healthcare. I have using my money. I have to utilize this well.
Yes.
And then they can see the doctor and they have time to talk to their doctor because it's no longer the little visits, because this is what we have to do to make ends meet because of the amount insurance is paying. And because it's telemedicine again, the overhead is lower.
Correct. No hospital beds. Yes.
No offices unless you choose to go to the office. You don't need as many assistants unless you choose.
Technology can triage for you.
Yes, and I'm looking forward to a bold or improvement in AI so that it will become a one-person solo practice. It's a one person that is doing the work, but something AI is assisting you doing everything else.
Because the AI is taking the notes as you're talking to the patient,
registering the patient, getting the bills, sending messages, reminders.
Yes, I think we're getting there. We're getting to that point because, again, people are, even just from my mini observation from the outside looking in, I know at least 3 doctors personally that I moved away from practicing in the hospital. My previous PCP just left. I'm just leaving because I'm not satisfied with the hospital systems anymore and the way that they are having me treat my patients. I went in with a different vision and now I'm unable to even have that level of connection with my patients. They're being timed. I have to do this, and I'm not even still be able to treat them in the way that they should be, to your point, preventive. But then because healthcare insurance requires you to go through these series of tests to prove before, and then the patient ends up paying so much more and spending so much more over the life of this illness where we could have just honed in straight on the main issue. But again, because of the system that we have, you're forced to work within the boundaries of the system.
Yeah, primary care physicians are rare breeds to find these days. You can hardly find one.
Yeah, it's heartbreaking. That actually is a good segue for me into just a general question that I have. Obviously, when people go to med school, it's a long training process, and then you're looking forward to this, and then residency hits, and then you have to apply through this matching system, and then you have people who, in some cases, do not match in a given year. But then we have a shortage of doctors. Like, how do you reconcile this system? This is a general personal curiosity that I have. I'm like, it feels like a no-brainer to match every resident unless they really are a bad student.
So I think the issue arises from the amount of slots that each program has. And the slots only happen because this is the amount of money they are being given to train doctors. So if they are given a certain amount of money to train doctors, they can only afford to
so much.
Yes.
That makes sense. That means we need to advocate for federal government to increase funding. So that's on you and I to do that, because again, I know a lot of doctors and medical students and residents, just being in the Nigerian community, and it's such a painful process to watch them on match week, waiting for this, and then
it's traumatic.
It's traumatizing.
The doctors or the medical students that are trained here, the bills they get at the end of the day, it discourages people from going into medicine.
Yes.
How do you live with a $250,000
debt?
bill?
Yes.
It's a lot.
Yes. So imagine going to med school and then you don't match, even after all of that.
Yeah, that'll be hard.
Yeah. But I just wanted to touch on that because that's something that I generally just wonder about, because again, we're talking about preventive care, healthcare in America and the world, but primarily in the USA, and having a PCP is helpful for preventive care. That's the first line of defense.
Yes, that's what primary care is all about. Aside from the continuity and seeing your doctor, it starts from the beginning. So we're not just gatekeepers. We are the people that go in this community and we do the screening. Mm-hmm. So we do the screening, we do the evaluations, when we do our wellness, our physicals, our yearly physicals. So we do the blood pressure checks, cholesterol checks, the cancer screenings, whatever is needed, and then we'll come, clean bill of health, or we've seen this, let's follow up on this.
Yes.
And you can only follow up because that person is your primary care physician. Exactly. It's not an urgent care person that you just meet once. And then when a chronic illness or disease is diagnosed, then you have a primary care physician that continues to help you manage it. Mm-hmm. They know you, they look at you, you can talk about your challenges.
Yes.
They can educate you about what the illness is. And even if it's that at the point where you're meeting them, there's already a complication from that health issue, they help you manage it. They refer you to the specialist you need to see. And they are the ones that serve as your quarterback, making sure everything you need is well coordinated, and you're coming back to them and they're looking to be sure, even after seeing the specialist, other things are not being neglected. You might be seeing a specialist for the heart, but you still need to do your mammogram.
Mm-hmm.
Yes, the primary care physician's role is very, very important. Mm. They are the ones that build the relationships.
Yes.
When I say gatekeepers, what I mean is they are the ones that if you have been treated well in the society, in the community, there's a reduced chance of you being hospitalized. Morbidity is reduced.
Yeah.
So managing health issues, chronic health issues, being diagnosed early, being screened, being vaccinated, all those help prevent hospitalizations and morbidity. And this is one of the reasons PCPs are important.
Very important. Okay. Mm-hmm. So you mentioned urgent care just now, and it brings me to want to talk about other places of care that a person can go to, especially in the US. If I need something like I have a flu that's just not going away, my first line of defense, me as a consumer now, I just go to CVS Minute Clinic and just go book an appointment, because that's the earliest I can get, because it's hard to get in with my PCP. And then there's also the urgent care. This is express clinic. There's just all forms of places that you can go to for care. So we know that obviously the PCP is the first line of defense, but in some cases, I have an urgent need to really see a doctor or to talk about something. Is that something that I can use a telemedicine service for, or do I need to go in person?
Telemedicine serves great when it comes to urgent care, not emergent care, urgent care. So your colds, your flus, your diarrheas, your coughs, things that are not chronic, things that are not persistent and have not been happening for 4 weeks. At times, in some situations, some people who cannot reach their PCP will come for their chronic issues too. Or maybe I need a medication refill for this chronic health issue I have, for my high blood pressure, my hypertension. I'm running out and I can't get my PCP. Yeah. Or they're telling me to come before I get a refill. Yeah. Or I have a cough. I saw my doctor 2-3 weeks ago, and they gave me antibiotics, but it's still persistent. What do I do? Or a patient comes to you and says, "Oh, I had urine burning and I went to the pharmacy and I picked up this thing and I have a UTI. Will you treat my UTI?"
Oh gosh.
Yes. Hygiene care works for things like that too.
So in that case, because you're not seeing them in person, you're seeing them virtually, do you typically recommend for them to go get a maybe at home test, for instance, so that you can get confirmation? How does that work for you to properly diagnose?
So in some cases, you don't need labs or confirmation. So treating a patient starts from the patient walking into the room. So virtually, it starts from you looking at the patient, then you are taking a history, you are listening to their symptoms, and then there's the science, which is the examination. At times, you have the patient self-examine, they're telling them what to do. So from that, then you can infer, you can say, this is most likely, which is what you would still do in clinic. And then you treat it. Something like a UTI, there's some very common signs and symptoms. And by the time you go through it, the most likely differential is a UTI. Right. And then you treat it, and you would always say follow up with your PCP or follow up in person if the symptoms don't resolve.
If it persists, I like that because I always wonder about how that works with
you would say follow up with your PCP or follow up with an in-person doctor or caregiver if the treatment plan is not working.
Earlier when we were talking, you mentioned gene therapy, and that's something that I've been very, personally interested in. I'm interested in a lot of things, generally speaking. When you talk about chronic conditions, for instance, they're persistent. It's almost like you have to manage this for life. In the case of chronic condition, but then I'm starting to see stuff about gene therapy and how they can re-engineer the gene to I don't know what that means.
This is all new. It's all new in medicine. It's everybody discovering and waiting with bated breath. That is this something we can do? Is this something we can use? Is this gonna be something that would solve issues? Yeah. So everybody's excited about it. Everybody's excited about getting genetic testing and getting treatment or therapy just designed for you alone. So everybody's excited about it and looking forward to it. And when you say chronic health issues, chronic is over 6 months. It's something, and I like that you said managed, because most of the chronic health issues can't be cured. Right? People need to know that because they think one tablet of my blood pressure medication and I'm fine. No, it's being managed.
Trust me, as somebody who lives with asthma, I know better. I have to manage it, and you were getting on me for that using my Preventive inhaler.
Yes. There's a reason you have preventive inhalers or maintenance inhalers so that you don't need the acute and you can enjoy your life. So that you can go up hills and you're not panting and needing it just makes sense to me.
I completely agree. And I've been reading a little bit about genetic testing and gene therapy, and I'm definitely interested in where that takes us as far as the future of healthcare, because that would be a game changer for people that live with chronic conditions or people with genetic conditions that would go from family to family. I'm definitely interested in seeing that. One last thing I want to talk about when it comes to telemedicine is the shift to home-based care. Hospitals now, there's a challenge of there's no bed space. Why do we have that challenge? It's the US of A. We have so much space, but that is a challenge that we have. And I'm starting to see like that shift to home care where similar to telemedicine, they can do home monitoring to help patients so that they are recovering in the comfort of their home. What can you say about that?
So most of the time when they say no beds, it's usually not because of unavailability of space. It's usually that they don't have people to take care of people on that bed. That's what I've seen.
It's a staff shortage.
So when you say home-based care, it can work in some situations where it's not severe. For some situations, this works and this is helpful. So like someone who has COPD and has recurrent needs or recurrent health issues or recurrent exacerbations, oftentimes they can be monitored at home. There can be remote monitoring. a doctor or a nurse looking at them and talking to them, and someone in the house being able to care for them. Or like home dialysis.
Home dialysis is one that,
too.
yes.
So dialysis is a big thing. Dialysis is where an artificial kidney of some sort, a machine acts as an artificial kidney in people who their kidneys are failed and are not working. And the kidneys are important in the body because they get rid of wastes. So if the kidneys are not functioning, a lot of things go wrong and one can't survive. So doing home-based dialysis is convenient for some people because they can turn it on and they can do it overnight.
Yeah.
Or something like home-based peritoneal dialysis too. Yeah. So all these things make it convenient for the patient so they don't have to go in all the time.
Yeah. No, I definitely appreciate that. One last thought that I want to share about preventive care, and it's double clicking on a point that I made earlier on my employer providing a health savings account that I can save money into, is I'm starting to see more organizations actually focus on wellness programs or integrate wellness programs into their benefits plans for their employees, because they realize work actually contributes heavily to burnout and stress for employees. So how can they also contribute to the preventive care of employees? We definitely have to do all these A1C testings annually, and then if you meet like certain criteria, then you get additional contributions towards your insurance payments, and I appreciate it, and I definitely try to meet those things.
So that's incentivizing preventive care, because if you go to and you get diagnosed early, so the days of morbidity is much lower. That means for the company, the days you call out is much lower. So for them, it's a win-win.
It's a win-win.
Yes.
Yeah. And I like that, organizations are starting to see that as an important thing that they need to focus on, because we spend so much time at work. Work is a huge driver of like stress and why we can't go out walking in the middle of the day. So I definitely appreciate that they're seeing that as, a way to help their employees. It's like, help me help you, and help me help you situation.
And some insurance companies are doing that too. They incentivize wellness. If you go for a wellness visit, you might get a card or you might get something deducted from something. So I think it's great. I think those are the policy changes we need to see. Focusing on preventive, on the grassroots, on the base, and by the time you diagnose early, by the time you start treatment early, then you don't have complications and the rate of morbidity, everything goes down. So yes, those are policy changes we need more of. We need to see.
Yeah, I mean, before we round up, obviously, I want you to talk a little bit about, or at least give advice to today's professional, both young and mid-level, is like as they are, going through life and going through their daily lives, like what should they be doing differently? How should they be helping themselves, their future selves, basically? What should I and our listeners be doing?
We are seeing the emergence, and we are seeing a lot of lifestyle diseases increasing. And like I said, lifestyle diseases, it's from the current lifestyle we're seeing. In those days of our forefathers, their work, most of their jobs were active. They went out, they did things, they went to the farms, they worked on the steel mills, they did all those things that involved physical activity. But these days, our weapon is our computer and our fingers, and we're all just sedentary. And being sedentary for a long time, isn't a good thing. And then because you have a lot of work, you're sedentary, the easiest thing to reach for is something being sold somewhere or being sold outside. At times that's fast food. At times it's just eating out. So that too could be contributing. And then staying longer hours, trying to achieve more. That too also affects the health, in that you don't have enough time for yourself, no time to distress, little time spent sleeping, having good quality sleep, and then time exercising. So if I were to advise myself, I would say, Toyin, take breaks. Maybe every hour, you take 5 to 10 minute breaks and walk around. Don't sit down on your chair. At times I laugh at myself and I say, one day my bum will be contoured to the way my chair looks because I sit down for so long. So get up, do something, walk around, pace around, do something, and try to exercise a few days a week. Try to eat right. Pre-plan your meals from the days you're not working, so that the days you're working, you have something already pre-done and you just finish it up. So living healthier is important. At least once a year, see your doctor. Be sure that you don't have anything that's not been diagnosed. Something that might just get diagnosed when there are complications arising, so that your future self will say thank you.
Yeah. How can people reach you to become their new PCP?
Okay, so there are several ways to reach me. You can go, since I have practices in both the US and Nigeria. In the US, you can go on VTR Health. That's VTR, then health.com, and you can make an appointment on the website. Or you can go on VTR Health on most of the social media platforms. You find me there: Facebook, Instagram, LinkedIn, and you can request from an appointment from links on there.
Nice.
And if it's in Nigeria, it's TelMD. That is like a telephone MD, TEL, MD doctor. If it's the website is telemdng.com. If it's the social media, telemdng for Instagram, telemdng for Facebook, and telemd Nigeria for LinkedIn. We have a custom number, vanity number, so that will be 1877 VTR Hill, HEAL.
Okay.
And for Nigeria, that will be 0707 660 7330. That'll be for TelMD. So you can reach me, however, in one of those ways.
Again, that is vtrhealth.com or telmdng.com for Nigeria. That is it. That's all we have for today. So grateful to have you in the studio.
Thank you for having me.
I enjoyed this conversation. I learned a lot. And you confirmed a lot of things that I saw online, because obviously I think we consult Google more than we consult actual doctors, and we need to stop doing that, because Google can be scary. You could misdiagnose yourself from just reading off online. I've learned a ton. Live healthier. See your doctors. Preventive care is definitely the first priority for you, and highly recommend that you get a PCP today if you do not have one. And if you don't have one, you know where to go. VTRhealth.com if you're in the US, telmdng.com if you're in Nigeria. Till then, follow us on all podcast platforms, 9 to 5 and everything in between, on Apple Podcasts, Spotify, Amazon Music, YouTube, and the visual is available on YouTube as well. And our social media handle is at the 9 to 5 Blueprint on all platforms: Facebook, Instagram, LinkedIn, TikTok. And the website is www.the9to5blueprint.com. Don't forget, you are the architect of your journey, and the investment that you put in today is what will yield great results for you in the future. See you next time. I'm your host, Elizabeth Ajadi, for the 9 to 5 and everything in between. Bye.